Hey, it's Kayla, a respiratory therapist. Let's talk about CPAP and acne. It can be one of the really frustrating parts of using a CPAP mask, especially if you have sensitive skin. It's always important to make sure that you wipe your cushion off when you wake up during the day. I like to use water wipes. They're 99% water and they do have aloe. Aloe is something that is going to help to moisturize and not break down that silicone. The oil from our skin is what causes that silicone to break down at a quicker pace. If your cushions aren't clean or your mask isn't clean, that could be one thing. If bacteria is getting trapped when you're wearing it, then that could be one of the reasons why you are having acne. When that bacteria is trapped under your mask and it has access to that warm and humid environment, that can really cause the bacteria for acne to thrive. Having your mask strapped too tight can also cause some areas of breakdown as well. You want to make sure that your mask is evenly adjusted at both sides at the same time so that your skin isn't prone to breakdown. One of the most difficult parts for adjusting to PAP therapy for me was getting into a good bedtime routine. When you wash your face with something nice and gentle like CeraVe even, what it does is it takes all of those oils and any type of makeup or residue that's on your skin and takes them away. You want to make sure that when you are drying your face that you do a pat dry as opposed to wiping it. That can also help to retain moisture in your skin. Using cleaners and wipes that have alcohol can actually strip the skin and trigger your body to produce more oil. That oil gets trapped while you're sleeping and you get acne. If you have sensitive skin, maybe you have an intolerance to silicone. You could always check out the AirTouch line. Those are masks that have a memory foam cushion as opposed to a silicone cushion. If you do have to use a moisturizer, try to use a moisturizer that is not oil-based, and you can try something that's aloe-based. I'll put a link down here at the bottom for a product that I have recommended for a lot of patients, and I've gotten a lot of great reviews. It is an aloe-based product, which is safe for silicone, and what it does is it creates a barrier as well as moisturizes your skin to really help protect your skin while you use those masks at night. A lot of masks also have the option of getting mask liners. Mask liners are great. Check out Amazon depending on the type of mask that you have. You can buy some that are disposable, you can buy some that are reusable. And they're really helpful because what they do is they create a barrier between the silicone and your skin, but they also help to prolong the life of your cushion. So if they work well for you, fantastic. If there's a specific one that you've used in the past that you like, let's talk about it. Others, I'm sure, would love to know. If you find that you continuously have redness when you're wearing a mask, then I would suggest that you try some different styles of masks. They have nasal pillows that tuck into your nose. That's going to be the least amount of silicone that your skin is subjected to. They have nasal cushions that just tuck underneath your nose, kind of like a snug hug. You can even get cushions that encapsulate your nose and remove any type of pressure placed directly on your nose. And then of course you've got the full face styles as well. Remember that it's always an option for you to change your masks out when you're using those. If you're finding that you start to get some redness at the base of your nose while you're using nasal pillows, give your skin a break. Maybe for the next couple days, try a full face mask, or you could potentially try one of the ones that encapsulate your nose. So if you're noticing that redness, giving your body the chance to be able to heal those things before you continue to keep putting pressure on it is a fantastic way of always making sure that you're protecting your skin the best that you can. If you find that you continue to have issues with acne and you've tried a couple different mask styles, you can always visit with your dermatologist as well, and they can get you hooked up with some meds that will help you decrease that acne. If your skin is starting to break out since you've been using PAP therapy, it's not your imagination. The same moisture and humidity that's in line for your PAP is the same moisture that can clog pores. A few simple changes like using a gentle soap, Making sure that you're caring for your skin and having a clean platform for your mask each night are ways to help decrease that acne. You can also try alternative masking styles. You can try some barrier cream. You can also use mask liners, and make sure that you always clean your mask off in the morning and allow it to air dry prior to use. Your skin deserves a good sleep, just like the rest.